Ever. You know, every Thursday we have a medical guest here on Fox Wilmington, and today Dr. William Hope, who is a surgeon with New Hanover Regional Medical Center's general surgery specialist, joining us. Dr. Hope, good morning. Thanks for coming in.
Thanks for having me.
We're going to talk about something that I have fortunately never had a hernia, but I've heard of so many people that have hernias. So I guess, first of all, help me understand what a hernia really is.
Okay, so a hernia is just a fancy doctor word for a hole. It's a hole that occurs in the abdominal wall, and it can kind of occur anywhere in the abdominal wall, most commonly at the belly button or the navel, but also in the groins or the inguinal regions. And it is one of the most common surgeries we do across the country and across the world, and one of the most common things we see as general surgeons.
Have I just been lucky?
Yeah, you've been lucky. They're probably, we don't know all the details about why people get hernias. Some people get hernias because they've had previous surgery. Those are called incisional hernias. As males have inguinal hernias much more common than females because of how we're built and weakening of the muscles. So yeah, I think you've just gotten lucky.
Well, good. That's about the only thing I've missed, it seems like. Is there anything that people do during the everyday life that can bring a hernia on? So
there are a lot of people that come to our office or that are seen that have been doing strenuous exercises or heavy lifting, and they'll feel something pop. And those things can incite hernias because there is weakness there, and often inguinal hernias can be caused by extreme activity. However, they can also come out without doing that. So both reasons.
So if I had a parent or a brother or sister that had a hernia, is it hereditary, or is it just something that normally would happen occasionally to
There
everyone?
are people that are more prone to developing hernias, and it has to do with the collagen or some of the makeup of the tissue in your body. So we're finding out more and more about this, but we do know that there are more people that are prone to having these than others.
You know, every kind of surgery is risky, but this is a common one, as you said. So tell me about how you repair a hernia if so many people are suffering from that.
So the most common way we repair a hernia is with something called mesh, and I know there's a lot of stuff out there about mesh lately that it may be bad, but for hernia surgery, almost all the hernias we repair, unless they're very, very small, require a piece of mesh, which is a type of synthetic material, almost like a plastic. And I always tell the patients, it's just like if you had a hole in your trousers or your jeans, you would sew in a patch. It's a similar type of deal. You have to close that hole with this piece of mesh and then close the tissue over it.
But it is surgery.
It is a surgery.
That's the key word there, surgery.
It is a surgery. It is a surgery. Almost, mostly they're done under general anesthesia. Occasionally we can do some of the surgeries with just sedation, but it's general anesthesia. Some of the hernias come in all shapes and sizes, so the smaller ones, sometimes they are outpatient surgery, so you can have the surgery and go home the same day. Some of the bigger and more complex ones, patients will stay in the hospital for several days, if not a week or so.
Okay. Dr. Hope, thanks very much.
Yeah,
I understand more about hernias, and I'm really lucky.
Well, great. Good to
see
you. That's right.
Thanks
Good to
for
see
joining
you.
us.